Hello everyone, welcome back to Soumen Met. Today we are starting our rare disease series and lecture 1 is focused on a newly recognized disorder known as Vexus syndrome. This disease is important because it combines hematology, immunology, rheumatology and molecular genetics. In today's lecture we will discuss the meaning of Vexus, genetics and pathogenesis, clinical features, bone marrow findings, subtypes, treatment, and important high-yield points. So now, what is Vexus syndrome? Vexus syndrome is a clonal, X-linked autoinflammatory and hematologic disorder caused by somatic mutations in the UBA1 gene. It is characterized by the systemic inflammation, hematologic abnormalities, bone marrow vacuoles, and myelodysplastic features. This syndrome was first described in 2020. Now let us understand the meaning of Vexus. V stands for vacuoles in myeloid and erythroid precursors cells. E stands for E1 ubiquitin activated enzymes. X stands for X-linked. A stands for autoinflammatory. S stands for somatic mutation. Vexus syndrome mainly affects the older men above 50 years of age. It is rare in females. Female patients may have Turner syndrome, monosomy X, and sometimes X chromosome inactivation. The disease occurs due to somatic mutation in UBA1 gene located on the X chromosome, and this mutation developed in the hematopoietic stem cells. As a result, clonal hematopoiesis develop in it, immunoactivation becomes dysregulated, cytokine release increases, and chronic inflammation occurs in the body. At the same time, bone marrow dysfunction develops, causing cytopenias and MDS-like changes. UBA1 normally encodes the E1 ubiquitin activated enzymes involved in protein degradation, cellular signaling, and immunoregulation. So now discuss the clinical manifestations. Patients may develop the recurrent fever. Recurrent fever is the main symptom. Additionally, fatigue, weight loss, and some hematological manifestations like the macrocytic anemia, thrombocytopenia, leukopenia, pancytopenia, and myelodysplastic syndrome. There are some rheumatological and inflammatory features also, like relapsing polychondritis, vasculitis, arthritis, and myositis. Dermatological manifestations include the sweat syndrome like lesion, neutrophilic dermatosis, and vasculitic rash. Also, pulmonary infiltrates is the main important features in some type pleuritis. And other manifestations include the venous thrombosis, ocular inflammation, and chondritis of ear or nose. So, after that, we will discuss the bone marrow hallmark findings. There mainly you see that hypercellularity dysplasia and clonal hematopoiesis and MDS-like syndromes. There's different features, and some diagnostic clues include the older male patient, inflammatory symptoms, elevated inflammatory markers, and marrow vacuoles. And then definite diagnosis is established by the UBA1 mutation testing. There are different subtypes: classical MET4-1 Vexus. Number 2 is the ACE56F UBA1 variant Vexus. This is most common type. Number 3, MDS associated Vexus. Number 4, inflammatory and rheumatologic predominant Vexus. There are some associated conditions in the Vexus syndrome that's associated with the myelodysplastic syndrome. Previously said that relapsing polychondritis, Sweet syndrome, Giant arthritis, plasma cell dyscrasia, and multiple myeloma. So, at last, what are the treatment option? They are mainly anti-inflammatory therapy like corticosteroids, IL-6 inhibitors, JAK inhibitors, and IL-1 inhibitors. Hematologic theory include some hypomethylating agents, and the prognosis is a very poor. And the major cause of mortality include the infection, marrow failure, thrombosis, and progressive inflammation in the body. So this is our complete overview of the vexus syndrome in the rare disease series lecture 1. If you found this lecture helpful, like the video, share with your friends and subscribe to Soumen Med. Thank you for watching.